All right, so here is my three takeaways, my 3-2-1, my three takeaways, two questions, one connection to social work practice. I'm going to do my best to be pretty brief, but I recognize that health practice is really, it's a loaded topic. And so I want to take the necessary time to make sure that it is addressed in a way that is understanding, is a way to help me process as I'm going along. And so, um, looking through all the material, I mean, I've, I have the privilege of taking two classes that are pretty similar in nature. Um, my human rights and social justice class, and then this one, the um, we got social policy for effective practice, analysis, implementation, stuff like that. And so they intersect pretty well. And so um, I've been able to kind of gain insight into different areas that are pretty important, policy implementation, but also just like the psychoeducation regarding what human rights and social justice even is. And so I'm going to lean pretty heavily on just um, strong evoked feelings from the readings, but also from experience, in addition to what I am learning in both classes, in an effort to kind of um, guide myself. And so, my first takeaway ultimately is that um, we, for whatever reason, um, we, the United States, just really just we like to champion and hit that gong so hard of like we are pro-life everything, we're all these things except when it comes to healthcare, because it's an insured healthcare. It's not um, a universality. It's something that is to be bought into. It's something that is not a handout, rather than um, pulling your bootstraps up, etc. It's just it's a system that really prides itself from, for whatever reason, the powers that be who implemented these policies thought that um, we just wanted to be different. It seems like I don't understand, and so that I'm getting disorganized. And so when I thought about my takeaways, I thought about my job, because at my job I'm a recovery coach. I'm a social work graduate student, and so I do a lot of case management with clients who are kind of in the maintenance level, but also experience all sorts of stages of change. Specifically, I either have pre-contemplative or I have maintenance. It's there's no in between, and so um, I see the vast array of oppression that goes on, and I have a really gigantic privilege at my job, in that at University Health, formerly Truman Medical Center, I work for a hospital system, and when I need healthcare, when I need something, I can get it, and it is free, unless I'm like, I need a nose job or I need Botox or whatever. Every aspect of my health, from my mouth, my eyes, from my head to the toe, is free. Now, when I access emergency medical service, I have to pay a fat $50 copay, but I leave with zero. I have a zero balance. And so I recognize my privilege with that, and how wonderful my mental health has been. My physical health has drastically improved because I've been taking care of myself with no fear of the repercussions, not repercussions, but like the fear of going home with a bill. And oftentimes we see people neglect their health because of the medical debt. Um, it's debilitating. There's something like 1 in 6 Americans um, have substantial, significant, debilitating medical debt, and half of the population is experiencing at least $1,000 in medical debt, which is insane to me. And so when I think about these takeaways, I think about the Housing First initiative, specifically as housing is healthcare. That's not really mentioned unless you look at Article 25 of the UDHR. And I see that a lot with my clients that I work with, in that, like, when you have a place, you have a place to seek solitude or safety, you're more willing to work on other things, like such as your health. When you are homeless, when you are experiencing that, you're not worried about your health. You're worried about your income. You're worried about getting a home. And so I think about the Housing First initiative a lot, in that if implemented correctly and well, and there's a lot of hands and feet in specific scenarios, the drastic measures of one's physical health, mental health care go through the roof, because of course it does. And so the things that my third takeaway would be, I thought about like the Flint, Michigan water crisis a lot, and how these citizens don't have access to clean water, which is a basic human right. We need food, water, shelter, clothing, and healthcare. And one of those is being compromised due to whatever. I haven't looked too deeply into it. Shame on me. But I think about the water crisis a lot. The pH levels in our water is getting alarmingly bad. I think about FMLA, and how every country does it so differently, but so much better than what the United States does. 12 weeks isn't enough time for mom and baby to develop a super strong attachment, especially the mama. Paternal postpartum are pretty severe, and the same-sex couples who are not allowed to have FMLA, those are medical rights. And I think about like the lack of knowledge or insight into the healthcare system that we developed for whatever reason. We don't know a whole lot about it. It's really confusing, and I wonder if it's purposeful. People don't read the terms and conditions when they sign up for an Apple ID. They sure as heck aren't reading the terms and conditions for insurance. And so I think there needs to be something implemented in a way that is easy to understand. It's often the reason whenever I call the doctor's office, I ask for a social worker. I don't ask for a nurse. I don't ask for the doctor. I ask for a social worker to provide education, to help me plan, prioritize certain things, because I trust them. I don't trust certain people because I've had bad experiences. My two questions with this is it arrogance? Like, why is it that other countries who are still healthy, who are still wealthy, have figured out healthcare, but we refuse? Like, do we listen? Do we care? That doesn't make sense to me. Like, what's the, what do we gain out of this for constantly making it impossible to attain, when other countries are thriving, have significantly better life expectancies than we do, experience a higher quality of life? It's just really frustrating. And so it kind of leads me into like a little trail, but there's a reason to it, and it's mainly because, like, when we often hear these pro-life versus pro-choice discussions, and how we're to value the baby in the mama's belly, the mama's womb. And this argument drives me wild, because how can you legitimately be pro-life when the value significantly decreases after birth? And so my assumption, my insight would be that to be pro-life, it is womb to tomb. It's healthcare needs to carry similar weight. That we need to champion, like, we're fighting like hell for these babies in this pro-life debate, in the same sense of the citizens that are here and now. And so I bring that up because hearing the confirmation hearing for our upcoming SCOTUS, Kintaje, I think is her name. Shout out to her; she's super awesome. They brought up, Roe v. Wade. They brought up all these things, and it's like we have to have that same energy projected towards healthcare because it is killing lots of people. It is tearing apart marriages. It's tearing apart a whole bunch of things due to medical debt, due to the marginalization of insured healthcare. And so when I think of this, I think of Article 25, and that this article has to mean something. This is my connection. This article has to mean something. And if we aren't actually working toward oneness with this piece, with the UDHR, then we need to identify or update this document or completely eliminate the UDHR, because Article 25 is at the forefront of my practice, and it has to be the forefront of others because it's been there for a long time and it's continually neglected. And I don't understand how you don't police that. I don't understand how you don't get sanctioned for that, because it is a core right, and this insured health care is not it. And we have this influx of money that we put into programs that are, they're necessary, but we are constantly neglecting our own people. And so it just has to be taken seriously. And if it's not being taken seriously, then there needs to be an assessment, and a goodness of fit conversation needs to be taken place, because this is not it. And so that's what my 3-2-1 is. This is important to me, and this is a legitimate human right, and it is not a privilege, and it is as evidenced by it being explicitly stated in the Universal Declaration of Human Rights. And I honestly don't think there's an argument otherwise, and there can't be, because this has been implemented since 1948 or something like that. It's a long time to be neglected. And so with that, I rest.